Hello everybody, I'm Greg Stock. I'm the CEO of Thibodaux Regional Health System. It's my pleasure today to introduce one of our new physicians, Dr. Alex Thibodeaux.
Yes, great to be here.
Dr. Thibodeaux, I'm going to let him tell you about himself, but as a welcome addition, his specialty is really pretty neat. He can take care of a lot of things really that trouble people, bother people, that cause pain and so forth.
So I was actually born in this very hospital, so believe it or not, hometown boy. Lived here about the first 12 or 13 years of my life, ended up moving to the Baton Rouge area.
Yeah.
I went to LSU for undergraduate and then LSU for medical school and residency in New Orleans. So I kind of made the tour of South Louisiana, if you will. Glad to be back here though, of course. In my fields, physical medicine and rehab, PM&R for short. It's kind of a unique field in the sense that we kind of cover a lot of different areas of study. The way I like to describe it is we're kind of experts on function. So any disability that would cause someone an issue, whether it be from a sports athlete injuring their knee, or whether it be someone having a stroke and then having weakness on the side of their body, our job is to really work on how can we make someone more functional.
So these old athletes that I see down here in the wellness center, they're banging away on the racks, but they're doing it kind of funny like because their shoulder hurts, right, or some old injury to their knee or whatever it may be. You can work with those people? Or?
Yes, sir. Of course. I think it's tough to start somewhere, but I think a lot of patients who have been just suffering with pain for many, many years and just don't know where to start, I think a good point, I'd be happy to see those patients and, establish goals of care. I think that's a big thing for me is talking to people and figuring out, well, what is your goal? Someone, it might be as simple as being able to walk, to the front of the driveway to get the mail, things like that. So it's really about establishing those sorts of goals. That's really important to me.
One of the comments you made that rang true to me was people have pains. They may build up over a period of time, and they know they probably should get something looked at and taken care of, and they don't, for a lot of reasons. But the truth is, you don't have to live with that pain so much anymore.
Exactly.
You want to talk about that?
Sure, of course. Like you mentioned, there's people that for a variety of reasons, whether it be work-life balance and things like that, they've learned to live with different aches and pains for years and years, and they've progressed and it's gotten worse to the point that it starts affecting them functionally. And where initially they may have been worried about missing a day off of work, now they're missing weeks off of work. And it's one of those things that if we can intervene earlier, then we can maintain functionality. It's about quality years of life as well. It's not just about, it's like you said, it's great that people are living longer, but we want to make sure those years that they're gaining are quality years of life where you actually have meaningful things that you're able to do. You're able to go out with your family, go on trips, or if you want to play pickleball or you want to play tennis. These are things that bring people joy, and without these things, it's just not the same. So I want to be able to provide quality years of life to people who otherwise, would not be able to do a lot of the things that they enjoy doing.
Well, great. Dr. Alex Thibodeaux, physical medicine and rehab physician, great young guy, new to our staff. Welcome.
Yes, sir.
Thank you.
Glad to be here.